Cost of smile design. Smile design is supposed to be an expensive treatment, and it requires your time, energy into it, and you get done caps or veneers or aligners or fillings and sometimes root canalizing and so many things for a smile design. So commonly people ask that like how expensive is a smile design and what does it cost, and how long does it last, and so many questions. So myself, Dr. Ankit from SERAPHIC Dental Indore. In this video I'll be explaining you about the cost of smile design. So well friends, why do we do smile design? First let's talk about this. Smile design is basically done to enhance your smile, to make it more beautiful, to make it more appealing, to make it more attractive. So what all issues do we address in smile design? All those issues which are anesthetic and you don't like them when you smile, like the gaps between your teeth. People don't want gap between their teeth, they want those gaps to be filled. The color of your teeth, the color should look very much natural and shining white. There are many shades of white although, but still people want white teeth in general, and they want them to be shining and natural looking. They want their teeth to be in perfect shape, so you don't want your teeth to be out of shape. You want them to be good shape, natural shape of the teeth. You want them to be in good shape. Then you want them to be in good alignment. You don't want your teeth to be crowded or overlapped on each other, or coming out of the arch, or going too much inside, coming too much outside. You don't want all these things. Lastly, you want your teeth to be in good alignment with the opposing jaw, and you want your teeth to be in good alignment with your lips and overall facial balance, or overall matching overall personality. So these all things are addressed in smile design. The color of your teeth, the shape of your teeth, the position of your teeth, and the gaps between your teeth, crowding or spacing, all these things. So the cost depends upon what all things need to be done. Suppose you want only one simple filling in the center of your face, between the two central incisors, like between the two center teeth. You just want that space to be filled, and that is very economic. You just get a composite filling done and it's done. Hardly a matter of 4, 5, 6,000. That's it. But if you want that all the teeth which are visible when you smile, like 6 to 8 teeth on the upper jaw and 6 to 8 teeth on the lower jaw, the color of all those teeth should be changed. Then you need to apply some veneers or crowns over them. So the veneers and crowns are costly. When you talk about an aesthetic looking veneer, it costs between somewhere 10 to 15,000. So now the cost will dramatically increase. If you want aligners, you want your teeth to be in good line. They are out of line, like some are coming out, some are going in, they are crowded, they are overlapped, going inside, outside, all these things are there. So you want to fix those issues. Then you want to wear invisible braces, which are called aligners. So aligners also will cost around 1.5 to 2 to 2.5 lakhs, depending upon the company of aligner you chose. Like Invisalign is the most expensive company. Then there are many Indian companies also which are a bit economical. So this is how the cost is going to vary. And suppose if after aligners you want now the color to be changed also, aligners will help to move the teeth. They will help to move the position of the teeth, but not the color, not the shape. So after you get your teeth in good line with aligners, now still you feel like I want to change the color also. Then you again need to apply something on your teeth, like veneers or caps or composite or whatever. So again now the cost will increase. So the cost depends upon how many teeth are to be addressed, what all issues are to be addressed, and what is your actual expectation out of the treatment. Like some people say that I'm okay if just there are no gaps between their teeth. Some say that I want everything to be very much perfect and very much natural. So then you need to address multiple issues. So these are the factors which ultimately will decide the cost. Simple fillings will be very economical, around 3, 4, 5,000. And if you do fillings in multiple teeth, then also it won't go beyond 15, 20k. But if you want aligners, so the minimum treatment will start from 50, 60k, and it may go up to 2.5 to 3 lakhs also. When you talk about veneers, so suppose you require only 2 veneers, so the cost will be calculated according to only 2 veneers. If you require 20 veneers, like you see in this case, we have done 20 veneers for this guy. This is a young guy, very good healthy teeth otherwise, but he has fluorosis stains over them, so they don't look good, they don't look appealing, they don't look attractive. So we did veneers 10 in the upper jaw and 10 in the lower jaw, so 20 veneers. So this is a costly smile design then. And if you want only upper 6 teeth to be corrected, then the cost will be almost 1/3 of that. So this is how the cost will vary. So what I want to convey to you, my friends, is that there is no fixed cost of smile design, and please don't ask the cost of smile design over a phone call to your dentist. You are listening to me from which corner of the world, I don't know, but this is my genuine advice that no one can tell you the exact cost of smile design on a phone call, even not in the pictures. Till we see the patient in front of our eyes, we can just give an idea by seeing the pictures, but the final confirmative price can only be told when we see the patient clinically. So we need to jot down what all things are to be done to give a fantastic, to give a beautiful, to give a natural looking result. So this is how the cost is decided, and once you discuss all the issues with your doctor, you also ask for a simulation photograph. Like you tell your dentist that show me that how would I be looking after getting a smile design treatment. He'll take your pictures. If he has those softwares and he can do digital scans, then the dentist will merge all these things and he will prepare a simulation. Simulation means that to show to the patient that how would the end result look like on his own face, on the patient's face. Then you get the most precise clue about what is exactly going to happen. One more thing is there, that there are multiple options to design a smile. It's not like that one patient can be done only with one way. There are many permutation combinations of the different treatment modalities which we can incorporate into that particular patient's treatment plan according to our experience and according to patient's expectations and patient's budget. So when you discuss these things in detail, then you discuss about the different treatment options and you ask about the pros and cons of each, you ask about the price of each. Then you can come to know that this thing is suitable for you in terms of treatment outcome, in terms of time duration of treatment, in terms of the cost of the treatment. So I hope that I am able to convey you that what is cost of smile design and how actually the cost of smile design is calculated. Still, if you have any queries, any doubts about smile design, then please feel free to contact on these numbers. Thank you.